in Iowa, the excise tax would be 25% sales price product. This issue was brought up in conjunction with the other bills we have out there right now. There's a variety of food products being sold in the consumable hemp area. And specifically when it comes to the production of the drinks out there, it was noted that here's just the reality. We have products being sold right next to alcohol in bars and restaurants where the alcohol has to pay a much higher tax. And this is a very high profit type drink here. The reality is the simple, for lack of better words, the simple syrup being used to make these products is sold up in Minneapolis, shipped down to Iowa, and then it's basically bottled up and distributed out here wise. So the question becomes is that should there be an equal taxation rate for a lot of these consumables and put on parity since it's being sold at the same area? That's kind of the impetus of the bill here. Should we treat these things like soda pop, or should we treat it like what's being sold next to is alcohol and beer? That's my opening comments. Senator, any opening comments?
Well, I understand what you're trying to do, but I can't support this because I think it's a little too far reaching when you talk about hemp consumables. As an example, a hemp consumable would be the oil that comes out of the hemp seeds. And before we even got into this, Hy-Vee used to sell an 8-ounce bottle of hemp oil for $9. And that stuff is high in omega and omega-3s. And it really, I was using it because I got an immune system disorder, and along with fish oil, krill oil, and actually the hemp oils work the best at really kind of stopping the development of this. So when we really started to do this stuff, it was more around healthcare and not about what you're talking about. So we kind of we're getting into the profit stuff versus the healthcare. And I know what you're trying to do. I think this bill might be, if we could focus it down, I could probably support it. But the way it's written is just too broad. And so I'm not going to be able to support it this time, but I know that you're sending some messages, and I understand that.
Good opening and closing comments.
Yeah.
Senator Driscoll, the opening comments.
No, I'll listen to what the lobby has to say.
Okay. We'll go around the room, who you are, who you're with, how you registered on the bill, any comments towards the bill, and then we'll go online to Zoom land. If you wish to speak to the bill, click the reactions button in the bottom corner of your screen. That will digitally indicate to us if you wish to speak to the bill. So without further ado.
My name is Kim Loeffler. I'm with Commercial Healthcare in Wellness, Cedar Rapids, Iowa, and I support what Mr. Trump said.
Same thing. My name is Patrick Loeffler, but I'm the reason why we have a Commercial Healthcare myself and back 8 years ago. We work with a lot of customers that are sent to us from the different hospitals in Cedar Rapids. A lot of those people are on fixed income that can't afford a medical card, let alone go to the dispensary and afford those prices. So just on one bottle of our oil is at $39.99. That lasts about 60 days that they have it offer. That's going to increase their cost by $10, almost $9.50. That's going to make it a tough sell for our customers. It's going to make it tough to keep fighting. Appreciate that.
Hi, good afternoon. My name is Teresa Mars. I'm here today on behalf of the Epilepsy Foundation. And so we are just registered as monitoring the bill right now, but have significant concerns with taxing all CBD products, because that's what this bill does based on how you've all defined it. And so if you look at, Senator Dawson, you and I have talked and we've shared these products before. So these would be a traditional CBD product that is sold in several of the traditional CBD stores that exist today. So those products all have some level of THC in them. Those are all federally legal products. And there are ones particularly, the Charlotte's Web product was specifically designed for, families with epilepsy. They use that with direction from their pediatrician, from their neurologist that directs them and tells them to use this product, and they get control with their seizures on that. So essentially, the way that the bill is drafted and the way that the other bill is drafted, you will be taxing medicine that is physician-directed care. And so I just want to be clear on including the topicals, right? So these are all the products that you, in a previous conversation, said that you're okay with, and you understand that these are all otherwise acceptable. I think that the bigger issue, and it doesn't specifically apply to this piece of legislation, but if you break out and define non-intoxicating CBD products different from D9 or Delta 9 hemp or THC only products, I think you'll get to your goal. Your goal is figuring out how do we put in parity, or how do we address the THC only products that can be intoxicating over a certain level. And so if you define those products, I think it gets you to your goal of what you're trying to accomplish. And so then if your bill was directed specifically at those Delta 9 THC only products, then we wouldn't have any issue with this piece of legislation that you're trying to accomplish. I would say that there's only one state in the country today that taxes consumable hemp products. It's Louisiana at 3% for information purposes. Then, with just also recognizing, you said, how do we put them in parity? So I challenge you then to look also then at vape products, and because they are also tobacco products, and then so put those on parity and tax those as well as you do cigarettes.
Yep.
Thank you.
Sorry.
Hi, I'm Lacey Nathan. I own 5 Your CBD Stores franchises here from Ames, Weston, Milwaukee, and Urbandale. I was the first person to open a CBD store 5 years ago, so that's come with quite the journey for me. I'm very passionate about this. I got into this industry because my dad has fibromyalgia, and through lots of different medications that changed a lot about him, we discovered CBD, didn't even know what it was at the time, and got alleviated fibromyalgia without having these terrible side effects, which prompted us to get into this business. When the hemp bill came out at the end of 2018, that opened up, everything nationally. So when it comes to taxing us 25% off products, we have no different margins than any other business, from a shoe store to a grocery store. We are small business owners. We're Ireland's. I'm a mother. A lot of us have families that we're supporting, and it's no different, and it's very unfair to even propose that crazy number of tax, in my opinion. When it comes to speaking on the THC piece, I very much agree with Teresa. We have to have definitions instead of lumping CBD, THC, medical marijuana, hemp, and cannabis all in one big pile, because they're vastly different. We are at my stores, we're very much for enforcement. We are for regulation. We have a USD organic stamp. We are quadruple checked. And a natural pull from a hemp plant does have THC. These are non-intoxicating products, and we are just fairly trying to get them to the public. Most of our customers are over the age of 40. We don't have a young market. We really have to focus on where these products are being sold, because right now, as it sits, you can buy them at vape stores, you can buy them at laundromats, you can buy them all over the place, and it's not appropriate. This is an enforcement issue. We've been screaming for enforcement for 3 years on our current laws. We don't feel like we need to change that. So thanks for allowing me to speak.
Leslie Parker with Iowa Mental Health Advocacy. This is a nuanced set of policies that need to be developed. I completely agree. I'm in support of the bill personally, mostly because my viewpoint is looking at the impact on young adults and children who are exposed to high levels of THC. We know that it's causing an increase in psychosis. We know that it's causing an increased rate of schizophrenia. I completely support medical uses where the evidence is showing that that's effective. I think that's absolutely appropriate. But I do agree that we do need definitions for the different products. But the high level THC, tax it all you want, and we can help prevent kids suffering.
David Edelman, with the Iowa Wholesale Beer Distributors Association. Obviously, we are interested in this from a clarity perspective of those products that are being sold in bars, for the THC, the Delta 9 piece that Teresa had talked about. So obviously, we do see a need for parity, when it comes to those types of products. The other idea, though, is this is, from what was discussed over in the House yesterday with the THC derived hemp. This is more for a social program as opposed to a medical. We have a medical program. You guys passed a medical program. That medical program is currently working, and by expanding the THC hemp derived products, you're basically hurting a medical program that you guys have already stood up. So just take that into